Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Wednesday, September 24th. On today's HITshow, an activist investor takes aim at Acadia Healthcare. Capital Rx rebrands with a massive funding round, and RevSpring scoops up Kyruus Health. Plus, a fast-growing virtual care startup raises $20 million. After the break, why ambulatory care is suddenly the hottest growth lever for hospitals and who's really writing the rulebook for health AI. Let's dive in. We start with big moves in behavioral health. Teresa, what's happening at Acadia?
Well, RHONDA, activist investor Engine Capital is pressuring Acadia Healthcare, one of the country's largest behavioral health providers. They're calling for new directors, asset sales, and share buybacks to boost performance. The letters sent to Acadia's board sparked an immediate market reaction. Acadia shares climbed on the news. Engine says the company's scale and footprint are valuable, but leadership hasn't maximized that potential.
So, Teresa, does this feel like the beginning of a long fight or more of a negotiating tactic?
Hard to say, RHONDA, but usually these campaigns unfold over months. Acadia will need to show investors it has a credible plan or risk ceding ground to the activists.
Got it. Thanks, Teresa. Now let's turn to a bold move by a benefits tech player. Logan, walk us through what's going on with Capital Rx.
Absolutely, Rhonda. Capital Rx just announced a $400 million financing led by Wellington Management and General Catalyst, with participation from firms like Goldman Sachs, Growth Equity, and others. That includes a $252 million Series F piece, among other contributions. Simultaneously, the company is rebranding as Judi Health to mark its shift from a pharmacy benefits manager to a full-spectrum benefits technology platform. The vision: integrate pharmacy, medical, dental, and vision benefits under a unified administrative and adjudication engine, reducing fragmentation and opaque cost structures. Judi's internal platform, also called Judi, is built to streamline claims and benefit workflows at scale.
That's a big pivot. Logan, how big is the staging ground here? What's the scale and valuation context?
This is a major leap. In its announcement, Capital Rx says it now covers 4 million employer PBM members and 54 million plan lives already under contract, giving it a sizable base to build from. Forbes reports that, with this round, its valuation has soared to about $3.25 billion, up from about $1.5 billion in its last raise.
That's solid insight. Thanks for the rundown, Logan. Now to a consolidation play that touches both patient access and revenue cycle. Peter?
Yes, RHONDA. RevSpring is acquiring Kyruus Health. Kyruus is known for powering provider search, scheduling, and data management, while RevSpring specializes in patient communications and payments. Together, they want to offer a connected journey, from finding a doctor to scheduling, to getting the bill and paying it. It's about stitching together patient-facing workflows that are usually fragmented.
Peter, what are you hearing from health systems about this deal?
Most see it as a natural consolidation. Hospitals want fewer vendors managing more of the patient journey, but integration will be key. Combining two complex platforms is never simple.
Absolutely. Thanks, Peter. And some fresh capital for a digital health player. Nate has that story.
Right, Rhonda. AmplifyMD has raised $20 million in a Series B round led by Forerunner Ventures. The company runs an AI-enabled multi-specialty virtual care platform that plugs directly into health systems. The pitch is simple: help hospitals and clinics expand access to specialists from cardiology to neurology without needing full-time hires in every facility.
So, Nate, is this about efficiency or access?
Both. Hospitals are strained for specialty coverage. AmplifyMD promises to fill those gaps virtually while also easing costs by optimizing staffing.
Thanks, Nate. When we come back, who's really setting the rules for health AI? And why ambulatory care is the growth story hospital CEOs can't ignore. Stay with us.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
You're listening to HITshow. We're back. Jade, the AI boom is running into a new problem. Who's in charge?
On the industry side, you've got the Coalition for Health AI, the Consumer Technology Association, and the Partnership on AI. From the public sector, the FDA is weighing regulatory frameworks, while the Office of the National Coordinator for Health IT and even the World Health Organization are shaping guidelines. The risk is fragmentation. Hospitals and vendors may face duplicate or even conflicting requirements, one framework for bias testing, another for transparency, another for clinical validation.
So, Jade, is anyone emerging as the frontrunner here?
Not yet. Some see FDA as the natural regulator, others want industry coalitions to lead. Until alignment happens, companies will likely have to design AI tools to satisfy multiple playbooks.
An important story. Thanks, Jade. Finally today, a trend-shaping provider strategy. Logan?
RHONDA, health system executives are doubling down on ambulatory growth, from ASCs to urgent care to virtual first models. The rationale is clear. Hospitals can't rely solely on inpatient margins anymore. Ambulatory sites are lower cost, consumer-friendly, and offer a pathway to sustainability. But here's why it's accelerating now. Payer pressure is pushing more care into outpatient settings. Reimbursement is stronger for procedures done at ASCs compared to full hospitals, and consumer expectations have shifted sharply toward convenience. Post-COVID, patients don't want to wait in a hospital unless it's absolutely necessary. For health systems, ambulatory growth also helps with network retention, keeping patients within their system across more touchpoints. By investing in outpatient hubs and digital access, systems can meet patients earlier in the care journey, direct them to appropriate services, and prevent leakage to competitors.
So, Logan, is this about following the money?
Partly, yes, but it's also about future-proofing. Systems that build strong ambulatory footprints now will be positioned to thrive as payers, employers, and patients increasingly prefer care outside the hospital walls.
A big strategic shift to watch. Thanks, Logan. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.